Let's now talk about teratogens. The embryo is most susceptible during organogenesis in the embryonic period, before week 8 of development. If exposure occurs before implantation, the effect is usually all or none, meaning the embryo either survives unaffected or is lost entirely. After week 8, which is the fetal period, teratogens primarily affect growth and function rather than structural development. Now let's go through the important teratogens and their effects. Medications. ACE inhibitors can cause renal failure, oligohydramnios, and hypocalvaria. Alkylating agents are associated with multiple anomalies, such as ear and facial abnormalities or absence of digits. Aminoglycosides cause ototoxicity. Remember it with the phrase, "A mean guy hit the baby in the ear." Antiepileptic drugs are well-known teratogens. They cause neural tube defects, cardiac defects, cleft palate, and skeletal abnormalities like phalanx or nail hypoplasia and facial dysmorphism. The most common culprits are valproate, carbamazepine, phenytoin, and phenobarbital. Because of this risk, high-dose folate supplementation is recommended during therapy. Diethylstilbestrol, or DES, increases the risk of vaginal clear cell adenocarcinoma and congenital Müllerian anomalies. Fluoroquinolones cause cartilage damage. Folate antagonists, such as trimethoprim and methotrexate, cause neural tube defects. Isotretinoin leads to severe defects, including craniofacial abnormalities such as microtia and dysmorphism, as well as central nervous system, cardiac, and thymic defects. Because of this, contraception is mandatory. To help recall, say isotretinoin for its teratogenicity. Lithium is associated with abstain anomaly of the heart. Methimazole causes aplasia cutis congenita, which is a congenital absence of skin, typically on the scalp. Tetracyclines lead to discolored teeth and inhibited bone growth. Remember them as teeth raceiclines. Thalidomide famously causes limb defects, such as phocomelia or flipper-like limbs. You can recall it with thalidomide. Warfarin causes bone and cartilage deformities, including stippled epiphyses, nasal and limb hypoplasia, along with optic nerve atrophy and cerebral hemorrhage. During pregnancy, heparin is preferred since it does not cross the placenta. The mnemonic goes, "In war, you need strong bones to march in optics to see the enemy." Substance use. Alcohol causes fetal alcohol syndrome. Cocaine is linked to preterm birth, low birth weight, and fetal growth restriction due to its vasoconstrictive effects. Tobacco smoking also causes preterm birth, low birth weight, which is the leading cause in resource-rich countries, fetal growth restriction, sudden infant death syndrome, and attention deficit hyperactivity disorder. The mechanism involves nicotine-induced vasoconstriction and carbon monoxide impairing oxygen delivery. Other teratogenic exposures. Iodine, whether in deficiency or excess, can cause congenital hypothyroidism. Maternal diabetes is associated with caudal regression syndrome. Cardiac defects such as transposition of the great arteries or ventricular septal defects, neural tube defects, macrosomia, neonatal hypoglycemia due to islet cell hyperplasia, polycythemia, and respiratory distress syndrome. Maternal PKU results in fetal growth restriction, microcephaly, intellectual disability, and congenital heart defects. Methylmercury exposure causes neurotoxicity. This is most concerning in top predator fish, such as shark, swordfish, king mackerel, and tilefish. Finally, X-rays can lead to microcephaly and intellectual disability. However, these risks are minimized with the use of lead shielding.